So, prior to performing the procedure, introduce up and verify client's identity. It is to be sure administering the procedure to the right person. So, good day, ma'am. I'm Nurse Elian Abidon who assists you today. Can I ask for your full name and age?
I'm Ayana Mayuga, 14 years old.
Okay, so explain the procedure and discuss how result will be used in planning further care treatment. It is to lessen anxiety and apprehension of the patient and gain cooperation. So, ma'am, I'm Nurse Elian Bidwan assist you today. And today I'll be assessing your appearance and mental status in order to assess your current mental capacity. So, ma'am, um, and I'll be asking you some question. Is that okay?
Yes.
Okay, so next is to perform hand hygiene and observe other appropriate infection prevention procedures. It is for infection control. Fourth is to provide for client's privacy to show respect to the client. So, ma'am, do you want me to close the door or something?
No, I think
Okay. So, fifth is to observe for the signs of distress in posture or facial expression. Okay, so normal findings, no distress noted. Six is to observe the body build, the height, and the weight in relation to the client's age, lifestyle, and health. Hey, ma'am, can you please stand up? Okay, good. So, proportionate varies with the lifestyle. 7 is to observe the client's posture and gait, standing, sitting, and walking. Okay, ma'am, can you please walk? Okay, sit down. Okay, so relax, erect posture, coordinated movement. 8 is to observe the client's overall hygiene and grooming. Okay, so clean and neat. 9 is to note the body and the breath odor. Okay, so no body odor relative to work or exercise or no breath odor. 10 is to note the obvious signs and health illness and skin color and the breathing. Okay, so well-developed, well-nourished, and intact skin is breathing. 11 is to assess the client's attitude. Okay, so cooperative, able to follow the instructions. 12 is to note the client's affect or mood, assess the appropriateness of the client's responsiveness. Hi, ma'am, are you okay right now?
yes.
Okay, so the mood of the client is appropriate to the situation. 13 is to listen for the quantity of the switch, the amount and pace, the quality, the loudness, the clarity, and the inflection. It must be understandable, moderate pace, clear tone and inflection, or it can be rapid or slow pace, or overly loud or soft. So, ma'am, can you say your name and age?
Ayana Mayuga, 14 years old.
Okay, so understandable, moderate pace, and clear tone. So 14 is to listen for the relevance and the organization of thoughts. Hey, ma'am, can you tell me where you are at right now?
We're at the hospital.
Okay, so the patient has a sense of reality. Lastly is to document the findings in the client record using the printed or electronic forms and checklists supplemented by the narrative notes when appropriate. It is for record and reporting. Hey, ma'am, thank you for your cooperation. Next is for assessing the external female genitalia. First, in preparation with the procedure, gather all the equipment needed. I'll be using the clean gloves. Here's the clean gloves. I'll be using also the drape and supplementing light if needed. It is to promote efficiency of the health procedure to be done. 12 is to, prior to performing the procedure, introduce of and verify the client's identity. It is to be sure you're administering the procedure to the right person. Third is to explain the procedure and discuss how the result will be used. And Planning further care treatments. It is to lessen anxiety and apprehension of the patient and gain cooperation. So, fourth is to perform hand hygiene and apply the gloves. Observe other appropriate infection prevention procedures. It is for infection control. Fifth is to provide for client's privacy to show respect to the client. So I already secured the client's privacy. Six is to inquire about the client's history to ensure accurate health assessment. Seven is to cover the public area with a sheet or drape at all times when the client is not actually being examined. Then position the client to supine to provide privacy and comfort. Eight is to inspect for the distribution, the amount, and the characteristic of the pubic hair. Okay, so generally kinky and demonstrating adult and distributed in the shape of an inverse triangle. 9 is to inspect the skin of the pubic area for parasites, inflammation, swelling, and lesions. It is to assess the pubic skin adequately and separate the labia majora and the labia minora. Okay, so the pubic skin is intact, no lesions. So the skin of the vulva are slightly darker than the rest of the body. So the labia is round, full, and relatively symmetric. So 10 is to inspect the clitoris, the urethral orifice, and the vaginal orifice when separating the labia. Okay, so the clitoris does not exceed 1 centimeters in width and 2 centimeters in length. So the urethral orifice appears as small slit and is the same color as surrounding tissues. Also, no inflammation, swelling, or discharge. 11 is to palpate the inguinal lymph nodes. Okay, so no signs of enlargement or tenderness. 13 is to remove and discard the gloves and perform hand hygiene. It is for infection control purposes. Lastly is to document the findings in the client's record. It is to provide quality care and help the healthcare providers evaluate the patient's plan of treatment. So, in preparation with the procedure, gather all the equipment needed, the clean gloves, to promote efficiency of the health procedure to be done. Second is prior to performing the procedure, introduce self and verify the client's identity. It is to be sure you administer the procedure to the right person. Third is to explain the procedure and discuss how the result will be used in planning further care or treatments. It is to lessen the anxiety and the apprehension of the patient and gain cooperation. For is to perform hand hygiene and apply the gloves and observe other appropriate infection prevention procedures. It is for infection control. Fifth is to provide for client's privacy to show respect to the client. Okay, so I already secured the client's privacy. Six is to inquire about the client's history to ensure accurate health assessment. Seven is to cover the public area with a sheet or drape at all times when the client is not actively being examined. It is to provide privacy and comfort. So, 8 is to inspect the distribution, the amount, and the characteristics of pubic hair. Okay, so triangular distribution often spreading up to the abdomen. 9 is to inspect the penis or the penile shaft and glance penis for lesions, nodules, swellings, and inflammation. Okay, so penis skin is intact. Also appears slightly wrinkled and varies in color as wildly as other body skin. Also, foreskin easily retractable from the glans penis, and the small amount of thick white smegma between the glans and foreskin. 10 is to inspect the urethral meatus for the swelling, inflammation, and discharge. Okay, so pink and slit-like appearance, and the position of the tip of the penis. 11 is to inspect the scrotum for appearance, general size, and the symmetry. Okay, so scrotal skin is darker in color than the rest of the body and is loose. The size also varies with the temperature changes. The dartos muscles contract when the area is cold and relax when the area is warm. Also, the scrotum appears asymmetric. Left testis is usually lower than the right testis. So 12 is to inspect both inguinal areas for bulges while the client is standing if possible. Okay, so no swelling or bulges. For 13 rather is to remove the and discard gloves and perform hand hygiene for record keeping purposes. Lastly is to remove and discard, perform hand hygiene for infection control. And lastly is to document findings in the client record for record keeping purposes.